If I had to provide global context of the issue, in the United Kingdom, it addresses its healthcare ethics with the NHS, which was established in 1948. And the NHS is pretty much a competent health program that helps all legal residents for free at the point of use, which is equal and universal access. Of course, no program is ever perfect. However, the treatment and easy coverage that it gives to all, it gives it pretty good central ethical commitment, and the UK system of the NHS program is really good as it shows that human health is better than just gaining money out of this. And in Canada, Canada operates pretty much fundamentally on a system known as Medicare, which is pretty much just ensures that all citizens and residents that are in the area just get easy access to health. And of course, each administrators have their own plans and rules in them, but the main focus of it will always be that it's easy and universal for everyone. Of course, that while Canada mostly focuses on the basic health of humans, the main problem is mostly that it just doesn't have much coverage for dental and prescription drugs. Still, the system is pretty good with its main principle that healthcare is meant for the public and not for its gains. And India faces like a lot of challenges with health and just care for its people, as most of its income and infrastructure is not as great as others. And while the government does do a bit of I guess resources for health services, most of the population still has to rely on underfunded hospitals, and if they have no other option, they have to go with very expensive private care, which will only lead them, I guess, with rags afterward. And there was a program launched in 2018 called the Bharat program. It was meant to provide insurance to the poor and vulnerable families, which is making it a little more universal and easy access. However, the concerns around it is that there is a little bit better of care with that program, though the only problem is that in other areas like corruption, there in rural areas and I guess suburbs, there is a lot of corruption and a lot of, I guess I could say, pettiness going around that still leads to problems with not many people can get that access to healthcare.